Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome, dear listener, and thank you for chiming in to listen to this episode around Christmas time of 2025. And I hope you had a merry, beautiful, happy Christmas and you enjoyed time with your family. In last week's episode, I talked about the urinary issues women experience as they age. And in this episode, I'm going to start by just recapping the urinary changes I talked about that are happening to the bladder and the urethra lining as a woman ages, as a woman loses her estrogen. So what are the exact changes happening to the urinary tract when a woman goes through menopause and loses her estrogen? Well, as it turns out, estrogen is very important to maintain elasticity and thickness of many tissues in a woman's body, including the bladder wall. The loss of estrogen, either due to age or due to other health conditions, will impact a woman's body even throughout her reproductive years and can cause a thinning of the bladder wall, impacting its ability to reject the bacteria, which always temporarily circulates around and is present in the urine without necessarily causing an infection. However, if the bladder wall is thinned out from the loss of estrogen, the bacteria will more easily attach themselves to the bladder wall, creating irritation symptoms and giving rise to the symptoms of a UTI. I mentioned the fact that low estrogen can impact younger women as well. I talked about this in the past. And I'm just going to do a quick little recap here because not just older women have these changes. These changes can happen in younger women who suffer from low estrogen for prolonged periods of time. So what would those conditions be? Well, we know that PCOS is a condition of estrogen dominance because women with PCOS make very little or no progesterone. But many women with PCOS do not ovulate, and their ovaries make tiny little eggs which do not mature into an actual ovulatory fertile follicle. They release these tiny little eggs, let's call them follicles, because that's the true name for them. They release a little bit of estrogen daily, comparable to a woman in perimenopause, even as low as a woman in menopause. There will be no hot flashes, but these women have low estrogen. Many young women do not make estrogen because their hypothalamus, the brain regulatory center, is disturbed and impacted by different conditions. Number 1, stress. Number 2, anorexia nerviosa. Number 3, by intense strenuous exercise. And unfortunately also by significant rapid weight loss. And the best examples for these are ballerinas and women athletes, as well as women who suffer from eating disorders. There are medications like chemotherapy or psychiatric medications, but even birth control pills can and will drastically reduce the natural estrogen to a menopause level. So if a woman is on psychiatric meds for many years and she doesn't have a period, she is at risk to have the same changes in her bladder as an older woman at menopause. Again, young women can suffer from low estrogen, not just older menopausal women, which is why understanding the fact that if the core issue of the changes happening in a woman's body, regardless of her age, are due to low estrogen, then simply using estrogen therapy will make a drastic impact and improve urinary health regardless of age. So if you're a mother or a grandmother and have a young woman in your life that you care for, and she might be going through something I mentioned in today's episode that just about describes a possible cause for their urinary issues, please have them see a doctor that can talk to them about testing their estrogen and addressing possibly low estrogen. So to me and many other doctors, it makes complete and total sense that a little estrogen is going to go a long way to help prevent UTIs, urinary tract infections, and keep overall a woman's urinary tract a lot healthier. So as it turns out, and I mentioned this in the last episode, estrogen is very important to maintain elasticity of many tissues in our bodies, including our skin. Hello, wrinkles be gone. The word on estrogen is out as being a wrinkle treatment. Many women ask for estrogen cream for their face. Well, this estrogen benefit of improved elasticity and better thickness totally applies when it comes to the bladder lining. As a woman loses estrogen due to menopause, due to aging, or other medical conditions, even when they're young, the bladder wall will become less elastic, will be stiffer, which will make the bladder much less able to distend to its normal capacity and allow storage of urine in between the times when a woman needs to go use the bathroom. Normally, the bladder can hold anywhere from 300 to 500 milliliters. And in some circumstances, in some people who are trained, like myself, and I'm not saying that with a sense of pride at all, the bladder could hold almost twice that, like as close to a liter. Some women, me included, are literally trained because of their lifestyle to hold their urine. They're busy, they're running around like crazy. So this is not healthy at all. And it could increase the risk for urinary tract infection even when a woman is perfectly healthy. So please don't do that, right? But just the normal bladder capacity, it's about 300 to 500 milliliters. As a woman ages and loses her estrogen, the more time she goes without estrogen, the more eventually the bladder wall will become thinner and less elastic, which will cause a decreased capacity of the bladder to distend. So slowly and gradually, the bladder will start sending signals to the brain saying, "Hello, I have too much urine accumulated. Please find a bathroom." And it will send these signals for needing you to go use the bathroom earlier and earlier for smaller and smaller quantities. Sometimes even when it's only filled at what used to be half capacity. So if your capacity was 300, now it's 150. If your capacity was 500, now it's 250. 250 is still a very good amount. So you might not notice that you're peeing less time and you spend less time on the toilet. Now, this explains why so many women suffer from urgency, frequency, and they need to get up at night to use the bathroom as their estrogen declines during perimenopause and menopause and becomes even worse in the years beyond menopause, especially when they've been without estrogen for decades. Now, as I entered my own menopause, I literally gave myself 8 months without periods to experience menopause in my body. Waking up in the middle of the night to use the bathroom. I promised you I'm going to tell you about my problems in the last episode, and I didn't, so I'm going to tell you about it in this episode. I would wake up in the middle of the night to use the bathroom sometimes 5 times a night, and it was a big issue for me. However, I put up with it, and so do many women. I woke up the next morning and went to work like nothing happened. Did I feel good? No. Was I tired all day? Yes. But I did what I had to do. I got up, did my job, saw all the patients, went home, cooked, cleaned, went to bed. Next night, same problem. Woke up constantly, peeing. The same happens to many women. Now, I'm naturally a very high energy person. I do not drink any coffee. I do not need any coffee to stay awake. I did flirt with bioidentical creams for estrogen for 2.5 years until I decided to give pellet hormone therapy a try. And there are 2 things that happened to me once my estrogen levels were steady and stable throughout the day for months in a row. Number 1, I was able to lose all the added weight gain from perimenopause and menopause within 6 months of having stable hormones. I lost 15 pounds in 3 months without trying. And number 2, my sleep was finally good quality uninterrupted for a minimum of 6 to 7 hours. And I was getting up at night to use the bathroom maybe once. Sometimes or most nights, not at all. My sleep was also a great quality sleep because I would wake up in the morning completely refreshed and ready to start my day. I remember one night there was a huge ruckus around 2 a.m. with our front yard water fountain, which is a stone-tiered fountain. Apparently, it made a big noise when the top part of it topped over, probably from something jumping on it or landing on it, a cat, an owl, who knows. My husband said the noise woke him up and he thought we were being attacked. There was an intruder. Such intense was the noise. So he got up, turned on the bedside flashlight. He went outside to investigate. He made a lot of noise while he was up and about, turning on lights to warn off possible intruders. He told me in the morning, I slept through the entire thing without even turning from one side to the other. And I remember he asked me, how do you do that? And I told him, it's my estrogen pellet, baby, and said a silent thank you to my hormone pellets. Poor quality sleep, interrupted by the need to void, is the reason why many women wake up exhausted, grumpy, irritable, and foggy. A woman going through perimenopause and menopause has enough issues. They really do not need to cope with the increased need to urinate all night long and maybe all day long. Imagine you just fell asleep, a hot flash woke you up, you threw your covers over, you cooled down, now you chilled, you cover yourself, you tucked in, you fall asleep, and then 15 minutes later you wake up because you need to go pee. And that goes on and on and on. It's a terrible thing, and there's a simple cure for it. A very easy fix. All the woman would need is a little bit of estrogen. Keep in mind, not all women respond the same, and what works really well for someone will not work in someone else. Keep in mind, hormone therapy has to be personalized and individualized because we all have our unique constellation of troubles when we go through menopause or as we age. And an estrogen product, which was a woman's savior, could be another woman's downfall, creating all kinds of problems and side effects. I'll do a whole podcast episode, maybe a series, on the topic of why hormone therapy needs to be highly personalized. But for now, let me focus on the urinary problems a woman is facing as she's going through and the years beyond menopause. I would like to point out a very simple truth that many women do not know, or if they know, it's not really at the top of their mind. And here it is. The hot flashes and the night sweats will get better. For some women, they will get better and disappear in 2 years. Those lucky women, right? And for some women, it will take 10 years. But the hot flashes, the sweating, and the sleep disturbances caused by that, including the fogginess and the irritability and the fatigue, will eventually get better and disappear. Now, many women, if not all women, believe they are over it. However, the naked truth is that the urinary problems brought on by the loss of estrogen and menopause are simply the beginning, and they will have no end without estrogen. For women who cannot or wish not to use estrogen therapy, are there other solutions? Yes, there are. Like I said, I will dedicate a podcast episode or a series to PRP injections, laser therapy, and how they work and why, and Kegels and electrical muscle stimulation, all of that. But estrogen is such a simple cure. Now, I'll get to those other things in another episode. I hinted at some of them in the last week's episode. But today's episode is about establishing in your mind, my listener, the real and the serious danger of ignoring urinary and pelvic floor troubles early on when they actually develop. As I mentioned a little earlier during the episode, at the beginning of this episode, the bladder wall will become inelastic and will lose its flexibility when estrogen disappears. And if this loss of elasticity, it's a process that has been ongoing for a decade or more, it will be very hard to reverse the changes in the bladder wall by simply starting estrogen therapy and expecting a quick fix in 2 weeks or 4 weeks, even 3 to 6 months. which is why the timing of therapy for the menopause and the age-driven urinary problems is crucial for a happy and optimal outcome. Starting estrogen much later, years or decades later, can and will help, but not as much as it could have helped had the hormone therapy started when a woman entered menopause or when she transitioned into her menopause. Estrogen does have highly beneficial impact on not just urinary, but also on the pelvic floor health. I clearly established that in the last week's episode. And I hope if you're not convinced by what I said in last week's episode, please do your own research. Here is the kicker. If a woman waits too long and delays estrogen therapy for many decades, maybe even many years, you probably don't have to wait decades for changes to happen to the point where the effectiveness in reversing or even meaningfully alleviating urinary and pelvic floor changes with estrogen therapy will be significantly reduced. We doctors need to be bold and upfront in telling women how valuable early intervention is to address such changes before they could possibly become permanent. I have a few patients in my practice in their 70s. We just started estrogen 6 months ago, 12 months ago, some 3 months ago, and they're struggling and they're waiting and they're like, I still get UTIs. They might be more spaced out, but they're still getting them. Again, the chance of complete reversal is only possible if estrogen therapy happens early. Once the bladder wall elasticity has been gone for a decade or more, it's very possible that the bladder capacity will have significantly shrunk permanently and that the urgency and frequency are there to stay. And there might not be a cure for you waking up in the middle of the night 3, 4, 5 times to void, and the medication like oxybutynin, Detrol, or Mirbedric, the medications that relax the bladder, might not work for you because your bladder has shrunk. I have not heard anyone speak about this or present it in this manner to the women preparing or going through menopause or women who are in the early postmenopause years. No one is seriously talking about the unimaginable toll urinary issues take on the quality of a woman's life as she ages. It's hard to imagine. Women probably think, well, it's not going to be me. That's not going to happen to me. Well, I would hate to be a broken record, but it might be you. If you're young and you're listening to this and you have an issue with estrogen and you want to go through menopause without any estrogen, this might be you. Statistics don't lie. Seniors buy a lot of diapers. The North American adult diaper market is estimated to grow from almost $6 billion in 2024 to over $10 billion in 2033 in the next 10 years. Urinary incontinence due to aging is a serious impediment in anyone's quality of life. Statistics indicate there's a 50 to 80% chance that a woman reaching her 8th decade of life will be incontinent. This is the truth that should be shouted from the rooftops, not that estrogen is bad and dangerous for women. Now, obviously, I'm fearless when it comes to estrogen, and so are many women. I have had the privilege to treat quite a few senior ladies who come to me after receiving a smidge of estrogen. Obviously, as estrogen therapy, not just vaginal estrogen, systemic estrogen. And they thank me profusely and express their gratitude in such ecstatic terms simply because their incontinence was 90% better or completely gone with just a smidge of estrogen. The majority of incontinence and the reason for leaking urine as a woman ages is caused because of the bladder wall quality and the functional changes which occur due to the loss of estrogen. The root cause of the problem for many women, probably the great majority of women after menopause, is estrogen. Imagine women who have worked hard their entire life to build careers, to build a family, and to raise their children into responsible adults, They deserve to age with dignity and good quality of life. They do not deserve to be told false information, creating fear and distrust of the one and only single tool which can restore their confidence and improve their quality of life. Obviously, I'm talking about estrogen therapy. And yes, it is still a great tool to use regardless of a woman's age. Mid-60s, late 60s, mid-70s, late 70s, it does not matter how old. Even if you are in your 80s, you can always try. Trying estrogen for minimum 6 months or longer, maybe up to a year, will be necessary. Both the doctor and the woman trying it will need to give estrogen therapy the time it needs to attempt to change and reverse that thinning, the loss of elasticity the bladder suffered from many years without estrogen, and due to aging on top of that. Now, here's the very interesting thing that many women do not know, and they're not being told because their doctors are not experienced and do not do pellet hormone therapy. But flooding the body, not in a bad way, is just consistent, persistent exposure with estrogen from a pellet will definitely get women where they want to get a lot faster. Because with pellet therapy, the lining of the bladder has that exposure to estrogen every minute of every hour, 24 hours a day, 7 days a week, 3 months at a time. Obviously, it depends on dose. It depends on how the woman processes the pellet, on all kinds of other factors. I don't want to make statements that apply to absolutely everybody. But in many women, the estrogen therapy can be unpleasant to tolerate because many women do complain of significant breast tenderness, especially when they're started or attempted to use estrogen therapy so late in life. Both the woman and the doctor have to be patient and have to be persistent and try multiple things until they find the right method and the right dose of estrogen delivery that would improve the urinary problems with zero or minimal side effects. So again, when considering estrogen therapy after many years of no estrogen, please be patient. And please be kind to your body and your doctor. Keep an open mind. Your body needs to adapt and adjust to having estrogen again. And understand that many things which were asleep could come back to life, including slow-growing estrogen-sensitive cancers. That is why a thorough evaluation, head to toe, matters. Not just, hey doc, please write me a prescription for some vaginal estrogen I heard is good for me, and please give it to me for 1 year so I don't have to see you again for a refill. That is not good care, and this hands-off approach is highly detrimental to many women. I will end this mini episode series here. I really wanted to bring attention to the urinary and pelvic floor issues that happen to women as they age. And why is it critical to prevent rather than treat? Or if clearly changes are happening to either or both the urinary health and the pelvic floor strength due to estrogen loss after menopause, then acting early and without delay will help reduce your burden as you age. Many women have pap smears with their primary care provider or a mid-level provider. And unfortunately, many OBGYNs are forced to delegate such services to mid-level providers. So consider making an additional appointment and call that your annual pelvic floor checkup, your annual urinary health checkup. Please go see an OBGYN for this specific reason, or a urogynecology specialist trained in evaluating the strength of your pelvic floor and the health of your vaginal lining and your urinary tract. It will be well worth it, even if your insurance will not consider this preventive, because it won't be preventive. You probably have atrophy, urgency, frequency, nocturia. All of these are medical conditions, and you will have to pay the copay and maybe the entire visit if you have a high deductible. It is worth it. The doctor will give you tools, strategies to help optimize your urinary health and your pelvic floor strength in order to prevent it from deteriorating. And please remember, and I'm closing 2025 with my favorite saying, 1 ounce of prevention is worth a ton of expensive cure. I leave you here, and I wish you a happy new 2026, and I will see you next year. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.